once you guys have decided that we want a tummy tuck surgery done, what is the care that you need to take before the day of your surgery? You'll have to, first of all, if you're a smoker, stop smoking for at least a month before the surgery, and at least a month, preferably 3 months after the surgery. And if it helps you quit smoking, that's a bonus. This is very important because if you smoke, the chances of there being what is called a skin necrosis, that is the skin becoming black and it's losing its blood supply, is very, very high. And this is one of the very undesirable complications after a tummy tuck surgery, because it makes the scar look much, much uglier than what it can look. The second thing you will need to do is, if you have any other health problems such as high blood pressure, diabetes, thyroid problems, and anything else, you'll need to continue these medications, get these things under absolute control, and then and only then can the tummy tuck surgery happen.